any tooth I take out by mistake is half off. How's that?
Hi everybody, I'm Lala Michelle. Thank you so much for tuning in. We have an interview with Dr. Bina here. Would you introduce yourself, explain who you are, what you do?
Yes, be glad to. I'm Dr. Bina. I'm at the general dentist practicing in Encino, California. Right at the corner of Ventura Boulevard and Havenhurst, which is down from Michael Jackson State for people who are familiar with it.
How important is flossing? How do you floss properly?
Hygiene is very important. And flossing is only one part. A lot of people think they can just brush or not floss, or floss not brush. It doesn't work that way. You have to keep your whole mouth clean. Plaque is a sticky material that sticks to your teeth. That's why it has to be mechanically removed. That's why we do the brushing. You have to brush your mouth. The misconception that people have is that they have to brush their mouth only twice a day, which is wrong. Twice a day is the minimum number of times you need to brush, because that's what people can do in the morning before they leave the house, and do once at night before going to bed. But during the time that you get at home, in the afternoon, anytime, or at work, you can carry your toothbrush. It's always good to break that cycle, remove that sticky material from your teeth, so you have a lesser chance of having problems, cavities, or gum issues.
What is tongue scraping? And is it important, and why?
Yes, tongue scraping is, everybody is more familiar with toothbrushing or flossing.
Yes.
Tongue scraping is also another way of cleaning your mouth, because the tongue has a lot of pores, and a lot of bacteria or plaque can be trapped in your on those pores that needs to be scraped off and cleaned. It's very simple. There are like some small devices you can use. You can even use your toothbrush. Just go a few times over your tongue, clean it. You feel much better, and also helps to have less bad breath.
So Dr. Bina, what is your most difficult patient experience and your funniest one?
Okay, most difficult one is whenever there are some people that are severe gaggers, and when we want to get an impression, always I must ask, because we have a different technology and we talk about it. But when you put an impression material, a lot of people gag. So I had people like throwing up. So that was one of the worst things I ever noticed. Well, not everywhere else. Yes. I ducked in time.
Good. You missed the projectile.
Exactly.
Ooh. And what's the funniest?
The funniest is they're numerous, because I love to joke around with my friends, my patients, like telling friends. We want to have like a fun atmosphere at the office all the time. But one of the things that stands out is like the lady that we did, I think, a tooth extraction, some minor surgery, and I was telling her the instructions, things to do and not to do. And I told her jokingly that you cannot have sex for about like 3-4 months. And then usually all my patients, they laugh, but I saw the puzzled face that she had. She was like thinking, trying to analyze and find the relationship of that. I was like, okay, I was just joking, and like she's, she had like a sigh of relief. She's like, oh.
So Dr. Bina, you have some advanced technology new to the office, and I'm excited to hear about it. Would you mind telling us more about what you have new?
Delighted, because I want to show off my new toys. You know, boys like toys, so I'm one of those, and I always want to be a better dentist, but that alone is not enough. Sometimes you need to also have the right tools to do it. And there are a lot of advances in dentistry, and I try to take advantage of all this new technology. Something as simple as the drill that everybody is familiar with. My drills are electric. They have less vibration, they cause less damage to the tooth, because sometimes those drills they vibrate, they can actually cause micro cracks in the tooth structure, not even noticing it. So something as simple as that is, we have it, but I also expand it to other things. Now we have 2 lasers. One laser does gum surgeries and even some tooth fillings with no numbing. And the other laser is for pain management, tooth whitening, and gum treatment. It's my new baby. It's my Ferrari in the office. I love using it for procedures that previously I had to open the gum and do some procedure and close it back up, like there's a procedure called crown lengthening where the decays under the gum. You have to open the gum, shape it, rip it off the bone, and put the gum back, put the stitches. I think we had to do for you.
Yeah.
But not anymore. It's much easier. Right now, everybody is what do you have? We have phones. We always look at it like this, and this is like a mess of all these muscles and tension that transfer to our jaw muscles. So a lot of people are now, even young people are grinding and have tension. So first thing, learn to use your phone or be at the straight level with the monitor, keep your head and posture properly.
So Dr. Bina, do you have any advice or anything that you would like to give to future dentists, current dentists?
Sure. Actually, that's I love to teach. That's one of the things I have my students. I love to learn. You must have that love and passion. And for new dentists or people who are thinking of going dentistry, it's a fantastic time in dentistry in terms of what we can do.
All right, Dr. Bina, we have some questions from our followers, our friends, and family. Our first question is from @_goldblooded, and they would like to know the downfalls to invisible liners, especially for people with wisdom teeth.
Actually, there is not much downtime with aligners, the invisible aligners. You can use it, you can wear it. Your wisdom teeth, if they are fully erupted and they're not interfering with the tray, that's not a problem. If they're almost like erupted, half erupted, they may cause some hindrance, so you cannot put the tray in. It can be adjusted, it can be trimmed, it can be planned accordingly from the beginning, but there should not be an issue.
Yeah. Well, there you go, gold-blooded. We have another question by Mr. CSR. How often should you get your teeth cleaned?
Very good question. That's because a lot of people have a misconception that they should get a cleaning every 6 months, which is totally wrong. And I'll tell you why. Because that's how insurances pay. They pay every 6 months, so people think that they should get a cleaning done every 6 months. Everybody has different cleaning habits. Everybody have different medical issues, and that changes your requirement for brushing or cleaning. I think you should have a cleaning every 3-4 months, depending on how well you do that at home. If you're doing a good job at home, you don't have any issues, maybe 4 months. If you skip the times or don't floss well, then maybe you should do it every 3 months. And the other thing that you need to know is that a lot of people take medications. Medication cause dry mouth because they cause other issues. If you have people have diabetes, for example, they have more gum issues. So it's not correct to have it every 6 months for someone that having issues with the gum and cleaning. So those people need to more often. Do it every 3-4 months. Talk to your dentist, talk to your hygienist to see what would be good for you.
Mm-hmm. Well, hopefully they'll come see you.
Yeah, hopefully.
Yeah. We have a question by @Gillard Mary Ann. Hi, Mommy.
Hi, Mom.
What's the difference between a veneer and an onlay?
Okay, veneer is like one of those fake nails that women apply to your nails, make it longer or different shapes. That's what a veneer is. That thing, the facing that goes over teeth is for cosmetic, for front teeth. There is one called no prep veneer, which means that you don't have to shave teeth. You put get an impression and make those veneers. Has limited application, but for some people that would be good. It's just putting a facing like you put on your nail, you put on your teeth, make it look beautiful and cosmetic work. Onlay is different. Onlay is the covering that goes over the tooth, just like a crown. Crown goes over the tooth, onlay goes over the tooth to protect the tooth from fracture. If you have lost a lot of tooth structure or you had a root canal done on the tooth, that needs protection, otherwise they break. But onlay is a bit more conservative. You don't have to shave as much. Whenever it's available, whenever it's possible, I do an onlay because I tend to be very conservative. I don't want to cut away the enamel too much, but it's not always possible. Sometimes you have to put what we call a full coverage, which is a crown.
Thank you for answering that.
You're welcome. My pleasure.
Okay guys, so Dr. Bina and I have a special surprise for you. Would you like to tell them?
Sure, of course. For all the Michelle's followers, I decided to have a introductory offer. A laser tooth whitening runs about $650. We decided to offer that to you at $150. We also include a full set of x-rays and a complete exam as part of that package. We are in Encino, California. The address is 16500 Ventura Boulevard, Suite 150.